Good afternoon, everyone. I'm Reid Hutchison, Community Economic Development Coordinator with Economic Development and Protective Services within Aberdeenshire Council. I'm your chair for this webinar. Welcome to the first of two webinars set up to assist community managed facilities and village halls as you navigate opening up as lockdown restrictions are eased per the government's phasing. Today's presentations are Duncan Lees, Boyndy Trust Chief Executive Officer, Fraser Stevens, Aberdeenshire Council Trainee Trade and Standards Officer, and Tim Stevens, Live Life Aberdeenshire Facilities and Funding Service Manager. For the questions and answer sessions, the speakers will be joined by Connie Strachan, Manager, McBee and Mintlaw, and Catherine Clark, Aberdeenshire Council Environmental Health Officer. Before I hand you over to the first speaker, I will cover a few housekeeping matters. Please use the live Q&A box on your screen rather than the chat option. We will take relevant questions to the topic of opening up community managed facilities and village halls, and I would ask that we stay on topic as it would be easy to be distracted trying to tackle all COVID-19 questions. The questions will be gathered throughout the session and during the Q&A session as well. We will try to address as many questions as possible. If we run out of time or questions require a more detailed response, the questions will be collated and updated onto the Council's website. This will allow you to refer to them or signpost to staff and other members of your organisation. The webinar is also being recorded and will be loaded up as quickly as possible to the Council's YouTube channel. I would like to introduce Duncan Lees, Chief Executive of one of the largest social enterprises in Aberdeenshire, and he will also be known to some in the audience through his other job at leading Bamshire Partnership, one of 6 Aberdeenshire rural partnerships. Duncan, over to you.
Well, good afternoon, everyone. And things like this depressed me somewhat by reminding me that I'm from a generation that went to school before there were computers. And so please be kind to an old man desperately trying to learn new technology and find out what the heck a webinar was when I agreed to be part of it. But hopefully some of you, hopefully lots of you will know and have visited and have spent money in our public building. The Boyndy Trust is a charity. We have a fairly large building near Banff open to the public. We've had it for many years. And it used to be a school. We've transformed it into a visitor centre, and that contains multiple different things, including a garden centre, a restaurant, gift shops, workshops, and about 7 acres of public gardens, recreational gardens. Like everybody else, in March, we had to close the building to the public and stop or radically alter just about every single other thing we did as an organisation. Normally what we do with our building, apart from being open to the public and trading, we provide skills development training for vulnerable adults, most of whom have special needs. And then with the other organisation that Reid mentioned, the other charity I head, Bamshire Partnership, from the building, we use the building as a hub to deliver things like dial-a-bus services, predominantly to elderly people, lunch clubs in partnership with Age Concern locally, and a whole range of different services. So as I said, it all came to a crashing halt in March, and we looked at alternative ways of delivering a number of our services, because there's a huge need for what we do. And I imagine virtually everybody who's on this webinar is providing services that are desperately important to their communities, both in terms of mental and physical health and well-being, combating both social and rural isolation, and economically important to their areas as well. So we do important stuff. As far as our place, as it's predominantly a garden centre, we were able to reopen it right at the end of May. As you know, garden centres were one of the first really to be able to reopen to the public, albeit with very significant changes to the way we normally would operate. So we wanted to open it as quickly as possible because we know it's so important to the area, but we needed to do so both legally and, most importantly, safely. I think what I'd like to do is perhaps say something a little bit personal about how that felt. And I have to say, I've run this organisation since it started 20 years ago, and it's probably one of the most stressful times I can ever remember, because we just felt so apprehensive about reopening the place to the public. Not because I was worried personally about getting COVID, although obviously it's a consideration at my age, but because we just don't want to do any harm. We set our organisation up to do good, so it is very stressful and really very thought-provoking, and you have a lot of decisions to make. But we did it, and it has worked pretty much flawlessly, although we are continually having to reinvent and keep up, and that's a feature at the moment of, you know, what you were doing last week might not be what you're going to be doing next week. So it's an exciting time, as they say. I think that's perhaps the phrase we should use. So what we had to do was to get a lot of information, and one of the things I would counsel you on is please try wherever possible to go back to the source of information. There is such a lot of information out in rumours and on social media by people who mean well but don't necessarily have it right. Same true of the press. I would really urge you to, wherever you can, go back to the proper official sources to check what the information is, and that's a lot of work. But you need that in order to be able to do what is basically a risk assessment. That's the main thing you need to do. Risk assessments, it sounds complicated. I actually don't think they are very complicated. You need to just break down everything you do, and you need to go through logically and systematically and look at every single bit of it. I literally do it by driving my car, parking it in the car park, thinking what it'd be like to come in through the main entrance, thinking what it'd be like to go into the shop or into the garden centre or whatever, and break down everything that way. That's the way I do it. I don't know whether that's right or wrong, but it's time consuming, and I would definitely urge that, well, for us, we felt we needed at least a week to go through and do all of that properly, and then get somebody else to come and check it. You know, somebody that hasn't done the risk assessment, come through and just look if it's right. Could be a member of your board, could be a colleague, whoever it might be. So that's the way we did it. And I think I can stress as well that this need to adapt, and it's not just adapt once, it's continually adapt. And your customers or whoever's going to use the building need to adapt as much as you do, for the person who's running the building. And we found on the whole, visitors and customers are prepared to adapt. And if they're not, there's not really much we can do to help them. They have to, because the whole country's adapting. So on the whole, we found people very respectful of systems and really genuinely wanting to follow what we're asking them to do. So that's been nice, and really grateful that we're trying hard, because people want to feel safe when they're in your environment. Some people will be looking at loopholes and how they can get round systems and what have you, but I can assure you the majority of people who come to us are looking to feel safe and think that things are being done right. So that's actually quite nice to work with, but it is very time consuming. There are experts locally, and a lot of them are on this webinar, and I have to say that I have found that everybody genuinely wants this to work. So when I've asked questions of experts or all kinds of different people, they do genuinely seem to want to help and seem to want to make things work rather than just deliberately being obstructive or putting barriers in the way. So I believe there is a true spirit of mutual cooperation and wish to get this right. And I'm going to finish really by saying that I believe we now have to do this. I think for our communities, particularly because of mental health and economy, we now really have to do this. We have to look at, if we can do things safely, we should do them. Doing nothing is now the wrong decision. So a lot of that is my personal experiences and my opinions, and that's really what I was asked to bring to this webinar. I think the people who come next are the very experts I'm talking about, who can tell you the detail and the technicalities.
Okay, thank you, Duncan. That was really helpful and interesting to hear your very honest experience and also the approach that you took. So I think that's been useful to help set the scene for the rest of the webinar. I'd like to introduce now Fraser Stephen. As I said, Fraser's a Trade and Standards Officer and actually has been involved in a multidisciplinary team with other colleagues in protective services in terms of providing support and guidance to businesses and communities. So I would just like to pass you on to Fraser now.
So I've been part of the Protective Services COVID-19 team. We've had trading standards staff, environmental health staff, licensing officers all working together, attempting to advise businesses as well we can. And I would say on the whole, the Shire has been very compliant, very willing to work with us. So I just really wanted to talk today and sort of give a general roadmap on what it is you need to be looking at, what the legislation is, things you need to consider, and what's possibly just around the corner. I'm sure you're all aware the law for this has been ever changing. It's very difficult to keep a track of, and I'm very sympathetic to that. So I'd like to, explain what's around the corner as best I can. Up until the 31st of July, unfortunately, because of the coronavirus response, community facilities could not be open except for very, very specific things such as, well, blood donations and food banks. But as of the 31st of July, this has been amended and community centres are free to reopen. So I'm imagining many of the businesses that are attending today, some of you may well already be open. And the other major thing I wanted to cover, in part because it's recently been added to the Health Protection Coronavirus Restrictions Scotland Regulations 2020. It's a catchy name, isn't it? Its face coverings would be mandatory within community facilities now. Previously it was guidance, now it is part of the law. You have a statutory duty for this to be the case. Now, there are obviously exemptions. At the end of the day, your responsibility should be to yourselves, to the staff of the halls. Individuals coming in, they are their own responsibility, and there will be people that are exempt due to age, due to health conditions. And our stance at the moment is ultimately you should be encouraging people to wear masks in your facilities as much as possible. Now I'm going to move on to this next bit, and unfortunately I wrote this slide at the start of the week, and some of this is already outdated. Our current guidance is, while you can be open where an activity can't be carried out in other sectors, I don't see there's any justifiable way that you could be hosting it. For example, at the moment, theatre has actually been announced as an indicative date of the 14th of September for resuming. Prior to that date, I don't really think you could justify having it in a community hall. And at the moment, you have things like indoor exercise aren't allowed, live music currently isn't allowed. But the First Minister earlier this week has given some dates for this. So for example, from the 24th of August, it may well be you could host bingo or host indoor snooker if that's something you would be interested in doing. Like Duncan's, I think Duncan highlighted it better than myself. I can only give very general guidance on this simply because the range of facilities and the range of activities you carry out is so vast. You've got everything from, you know, playgroups to, you got community facilities that have their own gardens. You have the men's sheds which have workshops within. It's such a diverse sector. It's very hard to give very specific advice that would be applicable to each and every one of you. So we would very much encourage people to look at sector specific advice, particularly in regards to activities which would be higher risk, such as indoor sport, which is from the 31st of August, indoor sport may well be available. That's the date the First Minister has indicated. I'd like to reiterate again, we would still expect social distancing to be in place on the premises, because, you know, that's still the requirement under law. So our face masks, and we would also encourage you to look at other things, like depending on the size of your hall, you may have choke points where when people are coming in and out, that would be where they might accumulate, and you could have some sort of queue management to manage that. And ultimately, you are the ones that can see where the risk points would be and what you might need to do to mitigate these things. But ultimately, the approach we would be taking is your responsibility is to your hall, to your trustees, and to your users. And therefore, that's where you should be focusing your efforts on. When the halls are actually booked and in use, if it's run by yourself, you're responsible for that activity. If it's another organisation, for example, say a third-party playgroup, you're responsible for managing the space, you're responsible for managing what they've hired, but it would be well within your rights to encourage them to take on their share of the cleaning. They have to keep the details of the children, for example. And this would apply for other activities, and we would encourage, you know, the people that are using your facilities to run activities to be involved in this process as well. If you hire out to people that are doing exercise classes, the teachers should make themselves aware of the sports guidance. I think it's going to have to be a very collaborative process, not just between yourselves and with us, but between yourselves and the people that your hall is there to benefit.
Thank you, Fraser. Fraser, along with his training standards and environmental health colleagues, I think have given us a good starting place in terms of the support and guidance that they can provide. I'd now like to pass on to Tim Stevens. Tim is the Aberdeenshire Live Life Now Aberdeenshire rep, and he's, like many of you in the audience, has been working his way through opening up activities. So I'll pass on to Tim now.
Thank you very much, Reid. I'm the Service Manager for Facilities and Funding for Live Life Aberdeenshire. I feel a bit of a fraud speaking to a lot of the people here today, because we run a very large range of facilities, ranging from community centres through to outdoor areas, through to swimming pools and major sports centres. But in fairness, you know, I'm very conscious that a number of smaller organisations have got their facilities open, and we are still in the process of opening up our facilities. That said, what I've been asked to do today is to talk about some of the steps we've taken in terms of managing a broad portfolio of facilities, and some of the key things that we've learned along the way. I've outlined some key steps on the first slide, and what I'm going to do now is just go through each of those key steps in a bit more detail to explain what I mean by them. In terms of service design, apologies, that sounds a very council-y speak. What we really mean by service design is sitting down and actually asking ourselves, what is it we expect or want to deliver within each of our facilities? So in terms of, you know, sometimes it is as simple as saying, well, how do we want to prioritise an area of use? Do we want to use it or prioritise it for early years groups? Do we wish to make it available for external lets? Or do we wish to primarily use this to deliver our own services? We've had to be a little bit innovative in terms of where it's delivered, in that often when we're dealing with a built facility, actually what's become more important to date has been the outdoors, and certainly some of the things we've concentrated on in the last 2 months has been looking at facilities that typically have been seen as simply public access, but actually bringing them in line, making them bookable, and linking them perhaps to some of our other facilities which might have some toileting facilities. We've also been acutely conscious in terms of thinking what we want to do in those facilities, when it can be delivered. And in terms of this, what we're really thinking about is being conscious going back to the previous speaker, that some activities we really want to promote, but they can't happen yet. And we're acutely conscious that if we've given away all our space in the first instance to people that are allowed to operate, that may then leave less time available at a later stage for others. So as an example, football clubs for young people have been able to operate. We're acutely conscious about not simply giving away space to those users, because that space is then taken away at a later stage from potentially theatre users who may wish to come in. I noticed as I was listening to the other presentations, there was a number of actions about building assessments. I think once we did the service design, the next thing we thought about was our building assessment. And I think there was a number of queries that sort of said, you know, the new Sports Scotland guidance or guidance relating to facilities, do you need to do the range of checks that, you know, is being advertised? The short answer from the council's perspective is yes. Most of our facilities have all been winterized or put into nominal use. They haven't had the public in. What we have been doing is been doing the basics to keep them ticking over. So they're not entirely shut down, but they are ticking over. Specifically in terms of Legionella, we've been running the taps to minimise dead legs every week. Having said that, every building we're bringing into use, we're doing a Legionella inspection, not necessarily doing the full cleanse, but certainly just going through the range of checks. We've certainly been looking at the electrical inspections to make sure they're up to date, heating inspections, and a range of other issues, so that when we open a facility, we can be absolutely sure that everything that needs to be in place is in place. And that has been time consuming, and on occasions, possibly because with the local authority, that has incurred some expenses. I put in a dafty. I put key steps management stakeholder agreement, and this may be more pertinent for a lot of community organisations. That as the council, we're looking at, and I shall be quite candid because of our financial situation, there's an element of us having to check that we can actually afford to open a particular facility, and I'm sure there'll be some questions on that later. However, as a byproduct, it is quite important, whoever you are, to ensure there is buy-in for opening a facility. And I take on board some of the points that I think people feel and we all want facilities to be open, but it is important that people are confident in doing that. And certainly when we talk about buy-in and your user buy-in, it is a case of having those conversations to say, are we happy? These are the plans. Is everyone in agreement? Checking with users they're actually going to use them, checking with committee members that ultimately are going to take a responsibility. Are you happy? Are you happy with this date? And I've put a nod in there for staff, because it is sometimes very easy to forget about staff members. And we're acutely conscious that staff members won't be home working. They will be the people going in and doing the cleaning. Probably the biggest surprise to us is the next step, the prioritisation of use. And again, this was specific to us as a large organisation, but I think it's worth sharing. And I've alluded to it earlier. One of the first things we've done, and some of you may have been written to by our director, is we had to have a look at our prioritisation of use. We totally accept, or we recognised at a very early stage, that at some point during 2020 we will have a quart into a pint pot in terms of excess demand and limited supply for a range of reasons. In order to manage that, one of the things we've done is actually look at the priority usage of who we're going to let into our buildings and how we want to manage that for a range of reasons. I mentioned earlier on, part of that is to make sure there is still space available for groups that can't yet use facilities but will come in. And we're acutely conscious that we don't want to get into a situation where it's simply a first come, first served, and those groups take up all the available space. I've put down there our council priorities, so I've been upfront and honest. We kept it very simple. Our current priorities for taking any kind of lets is top priority, organising, supporting parents in returning to work. So that's related to not just statutory preschool education, but organisations that are providing wraparound childcare. And we're very keen to support parents with the young people going back to school. We're also keen to support parents going back to school. So we have given a degree of priority in terms of what we have, and that's led to which facilities we've opened. We've put that in as a top priority, certainly to link in with the return to school. We then looked at organisations delivering services outdoor. We have a large sporting aspect. we've been very keen to support the current pushes at the minute to make sure that people can safely return to the outdoors. Daft thing to say, the next priority is existing services. We don't want to forget loyalty. You know, we're aware that people have been used to having lets. They have a range of programs. We're very keen that they're the next priority behind the two we've mentioned so far. And a fourth priority, and I'll be quite candid, this we mean as it's not really a priority, it's actually what we're not going to do for the time being. We're being very clear that because of the quart into a pint pot situation, we're not by and large allowing new users in, and we're being very careful when existing users say we've got a fantastic opportunity, we'd now like to expand our services. So the line we're taking is, even if you're a priority one, you're delivering an out of school care service. We've had a number of groups come in saying it's great, you know, there's now lots of space, we can deliver services other people can't, we'd like to expand. What we've said is no, your expansion's priority 4, what you've previously delivered is priority 1. And we've been very honest, that's because we do need to fit everyone in, and that process is going to continue throughout 2020. In terms of some of our policy changes, again, they're not really policy changes because they're not formal. What we have recognised is we're not opening some facilities, and therefore the users of those facilities are being offered alternative accommodation elsewhere. And we've sometimes had the scenario, and I'm sure some people here will recognise this, where an existing user said, well, we're not moving out of the way for the group from the town next door. And we've had to say, no, you are, because if their facility is closed, we need to share and share alike for a period of time. And therefore squatters' rights, and we did used to have an element of squatters' rights, it is null and void. We're trying to share it out equally around all our communities. And we're doing that on a very much timed basis. At the minute, we're not agreeing any lets apart from priority 1 groups further than October, and that's because what we anticipate doing is getting people bedded into October. We'll then be reviewing those lets, and that might mean that some people that have lets currently might have to scale back some of their lets until Christmas, as we have more people being able to deliver services. So that's probably been one of the most difficult areas we've had to deal with, because clearly if you're an organisation that just wants to get in and has had a history of usage and you're being told you can't have what you've previously had, it can be quite difficult. But having said that, that's worked reasonably well in terms of managing that demand. In terms of practical actions, I'm perhaps coming back now. And again, I think my colleagues previously mentioned the issues of risk assessments, and I'd echo what's been said. In terms of how you actually open, risk assessments underpin everything, and I've specifically referenced timetabling, making people feel safe, and I'll pick on that because what we've found, and I'm sure others have found, is there are sometimes things you don't need to do in a risk assessment. You can evaluate it. You may still choose to do it because a big part of what facility operators do is to make people feel safe. And sometimes there's a value in doing something which might not necessarily have a practical purpose, but it does make people feel safe. I think that's very important, certainly if you're looking at bringing the general public back into facilities. I've also put a nod there to cleaning regimes, because I'm sure you're all familiar with that, and making sure that you can access PPE, although in fairness, that's possibly less of an issue now than it was a few months ago. Pricing, and again, I noticed some of the comments. Difficult thing, I haven't got any answers to this one, but one of the things we're having to look at is we are incurring, as I'm sure many of you are, significant extra costs, and the ability for people, because of capacity reducing, to actually, or the ability of facilities to generate income is going the other way. So that is creating an issue. The only thing I can say is what we're trying to do is have very sensible conversations with groups. We obviously, and no one can run a building at a loss, I think that's taken as read, but equally we're very conscious that we don't want groups to go under simply because they have an issue at a point in time. And in many cases, sometimes the affordability of what people want to do can be a good reason to have an honest discussion about delaying their return to a facility, to give them a bit of time to look at how they want to manage their particular services. And lastly, constant review, what works and what does not. And in my particular position, it's probably also worth me saying you have to constantly review, because as we discovered yesterday, just when you think you understand all the rules, something changes. Yesterday, you're all aware the Scottish Government surprised us a wee bit by opening up sports facilities 2 weeks earlier. So you have to review what you've got and rethink it. I'm coming to the end. I'll just take a sip of water if you bear with me. Just some key learning points that I think it's worth me touching on. Marketing and publicity. No matter what you do, we find, you know, there will be criticism simply because in these unique circumstances, it's very difficult to keep on top of all the information. I don't like to say that the Scottish Government's given conflicting advice because I have a lot of sympathy with them. It must be extraordinarily difficult. That said, advice changes daily and keeping on top of it's very difficult, and I don't think that's going to change. That said, keeping your users informed and having a plan for how you keep that informed, even if it's just basic through Facebook, etc., is an excellent idea. And develop a thick skin because people will still criticise you no matter how hard you try. One of the things we're at pains to do is to highlight to all users, and to be honest, when people come in and say you're not doing this as we would like it, things have changed. Things aren't going to go back to the way they were for a fair while yet, certainly not for 2020. And I think we're finding it far easier to be straight with people about what we can do, and that's often meaning we're telling users they can't have what they've had previously, but being honest has certainly been the best. I've mentioned a couple of times previously about the need to protect existing and potential users who can't yet access facilities. Again, I think that's one thing that I'm quite proud of. We haven't given away facilities simply to, you know, to allocate facilities to people that can afford it. That's been a bit difficult on some occasions, as sometimes people have said, we know you have a space, we want to use it. Please accept our money and let us get on with it. And we've had to be quite tough about saying no because we want that space for something else. And I know damn fine that once you get in there, it'll be very difficult to move you out at someone else's expense, but I think that's the right thing to do. Grey area, group's own risk assessments. I saw a couple of questions earlier on about, do we, you know, where does the responsibility of the facility operator stop and the delivery of the service begin? And that's when you're the facility operator, you've got a booking from a group that wants to get in. It is a difficult area. The line we're taking is that we are always responsible for the building, and we have to ensure that, you know, the space is passed across to a group in an appropriate and safe fashion. We then look at their risk assessments to check that their risk assessments comply with their own governing body guidance and don't create a conflict with our risk assessments. It is possible, in my opinion, on some occasions to pass on some things like cleaning responsibilities to a group. So if a group, you know, in its risk assessment identifies it will clean up after itself, we would take the view that that's acceptable. However, we have to police that that's done appropriately. So it's okay for a group to agree to take on a cleaning responsibility. Unfortunately, as building operator, you never ever get rid of the need to ensure that it's been done properly, because your responsibility will always be to the group that's coming in next. And lastly, keeping up to date with the relevant national guidance. As a last slide, and I'm sure Reid will send this round at the end, create a very simple facility checklist, which is an edit from one that we use for our facilities. So if people find that helpful, and when these slides are sent around, hopefully that will be of some use. Thank you very much.
Thank you, Tim. And yes, now, as we said, there will be a recording, and definitely all the resources are going to be available. So just before we go into the Q&A, what I'm going to do actually is share my screen, because what we actually have is a number of useful links. I appreciate you can't obviously now access those now from the screen, but I know that David in the background is going to start putting them into the Q&A chat. And so we're just about to get ready to move into the Q&A bit. So just bear with me a second. I've just put up the panel. So I'll pick a question that seems to be liked by a number of the audience. So it was a question from Sheila Richardson, who says, are there any written guidelines on letting user groups back into village halls, e.g. cleaning space for people taking part in exercise groups, etc.? Would it be good to have a document to hand out to groups coming back after lockdown? And I believe, Fraser, you're going to unmute yourself and come into that question.
I am indeed. There is written guidance. That's the slide with all the links shown on the training standards page, there is a link to some village hall guidance that was worked up, and it in turn links to a lot of useful guidance. I don't necessarily know if there exists anything pre-written that you could just hand out to community groups coming into the space, but there is guidance that exists. For example, the guidance there, it links to the current Scottish Government stance on cleaning, how often you should do that, what sort of things are appropriate, you know, things like, you know, using a disinfectant rather than a detergent, trying to do it every 2 hours is, I believe, the current guidance. And space for people taking place in exercise groups. Sport Scotland have got some very good guidance, and what they are recommending, the example a lot of people seem to be asking in the chat is yoga is a 9-meter sort of box, so that people can ensure they are at least 2 meters away from each other at all times. But I don't believe there is one size fits all document, and I believe that's a side effect simply just because community spaces and village halls get used for so many disparate activities. I don't think you would get one document that could cover everything that they're being used for, I'm afraid.
Okay, thank you for that, Fraser. As I say, you need to bear with us, folks. We've got a number of questions, which is really good, and it's good that we're getting a good stimulation in terms of debate. So we'll just try and work our way through them and try and bring in as many panel members as possible. So the next question that I'm seeing on my screen is, has any date been advised as to when Hall should reopen? So I don't know if, again, back to Fraser or Catherine, if one of you wants to come in to answer that question.
I can quickly take that. Basically, as of the 31st of July, there is no restriction on the law on when you're allowed to reopen. If your question is when you should reopen, I don't really think it's basically based on when you believe you have a risk assessment in place and you can reopen safely for activities that can be carried out safely. But in terms of the legislative restriction, there is no ban on community centres and facilities opening. You could be open as we speak, and that would be legal, provided, of course, you took all appropriate measures.
Okay, and I don't know, Duncan, I'm seeing you nodding your head. Duncan, do you want to maybe unmute and come in if there's anything to add to that?
Yes, I think that's there's a real differentiation. I think there's an overall piece of work you need to do to make sure that the building is safe, and that would cover things like the toilets, for example. But as has been said, and I just really want to re-emphasize the point, it's much more about what you're actually going to do with or inside the building. And I completely agree that you're not going to be able to do everything yet that village hall, or in our case, our building used to do from sort of February backwards. So you need to prioritize it to some extent. Obviously, you prioritize it with whether or not it's financially viable. But I would strongly suggest that a key thing is what is really needed in your community, who are the people that really need a service because of their mental health. You know, is there an activity that could be done in the hall that's going to have a lot more benefit for particularly vulnerable and needy people within your community? And then you look at the risks of that. And in our case, for example, we've realized that there's lots of things that we can do using our gardens that traditionally we would have done using our building. So, you know, don't forget that your building has a car park maybe, or possibly some green spaces around it or whatever. And I would strongly suggest that the speaker who said about prioritizing the activity and trying to make sure that it matches what the community needs, I think that's absolutely vital and a key point.
Okay, thank you for that. So as I say, next question, we're just trying to work our way through them, folks. So what ventilation is required, especially during winter and colder months? So Tim, do you want to maybe come into that one?
I'm trying to. My mute button is difficult. The short answer is that we don't know. From our perspective, we've had some guidance, and we cheat a wee bit and get advice from our property section. The only thing I can say is that certainly ensuring you have a clear throughput of air, whether that's through mechanical systems or through your risk assessment to look at how you can do that in your building is probably going to be important, but I'm not going to pretend to be an expert on that.
Okay, no, that's fine. And unless somebody else wants to come in, I'll just maybe just move quickly on if that's okay, just to try and see if we can get through as many of these as possible.
Sorry,
yes.
Just quickly, sorry, this is Connie Strachan here. There is actually an updated bit about ventilation on UK Gov. They just uploaded it on the 17th, and it's quite confusing, but it does say it should be fresh air and basically not air conditioning units and things like that. So I have got screenshots and things, but you'd be better going on to UK Gov, Scott, and if you go into gyms, then it should come up. It's dated the 17th of August. Hopefully that'll be able to help you.
Thank you. No, that's excellent. Thank you, Connie, and we'll make sure we get that linked in when we circulate this. So as I say, moving through the list then, so what cleaning materials must be used? Can we use what we used before closing down, cleaning down equipment, etc., or do we need to look at new practices? So again, now maybe bring an environmental health perspective here, Catherine, and then followed by Tim. Can you give any advice in that regard?
Yeah, you don't require any specific cleaning materials. What we're looking at is really enhanced cleaning. So perhaps ensuring that you're cleaning at the appropriate times. You're cleaning the appropriate places. For example, if you had a kitchen, you might be cleaning food contact surfaces before. Now you're looking at hand contact surfaces. So you really need to do a risk assessment of what needs cleaned and when. In terms of, and there's plenty of guidance out there about what materials and chemicals you can use, but it doesn't require specific types of chemical.
Okay,
that's fine. And else want to come in, or we'll just move
through? I wasn't going to add to that. I was going to sort of come in as an adjunct and say one issue that we went through the gamut on, and I know a number of other people have raised questions, is the issue of cleaning toilets within that. And rather than get into the detail, I would certainly, one of the things that we found very helpful has been the national guidance for the cleaning of public toilets, as it gives some quite good ideas in terms of if you're allowing the general public access to your loos who may not be using the facility, and also some of the myths and rumours about toileting for your existing users. So I'm conscious a number of people, if they haven't asked that, probably would be interested in that, and I think that's a very useful document.
Okay, thank you. And so next I'm going to say, so we've got a question from Rachel from the glass community. So she's asking, presumably we will operate our track and trace system. What information should we ask for? Name, address, telephone number, etc. And how long should we hold this information on records so as not to compromise GDPR regulations? So I'm looking to see who could come in with that one. Duncan, in you come.
Yeah, so I said I wouldn't answer any questions as an expert, so hopefully I'll get this right. What we're using for our restaurant is so Trace and Protect, NHS Trace and Protect is the Scottish system, and as far as I know, what they really need to know is a way of tracing an individual. So that could be preferably a telephone number, but it could be a postal address if need be. I think probably even an email if it has to be. Largely what they need to do is be able to get in touch with somebody. They need to know when they were in the establishment, so when they came in and hopefully when they left, because it's all about tracing people. So they need to know who was there at a specific time and how to get hold of them. And my understanding is you should keep that information for 21 days. And to comply with data protection, it should only be used for that purpose. In other words, so from our point of view, we're using a manual system. We're getting people to actually fill in a piece of paper rather than electronically. We put them unread into a sealed envelope, and at the end of 21 days, we dispose of them appropriately. So GDPR doesn't come in unless you pass that information to somebody other than trace and protect. So that's me being an expert, and hopefully I've got it right.
Okay, thank you. Now I'm going to do a wee bit of a segue here, so I'll give you the heads up, Fraser, and then I'm going to draw you in this one. So what do we do if Test and Protect team get in touch with us to say someone has been in our hall and they were suspected of having come in contact with coronavirus? Do we need to do anything? You're on mute, Fraser, so just come off.
I'm coming off now.
Yeah.
Basically, there's a lot of people, and I think this is one of those things where, like as Duncan said earlier, there's a lot of things going around on social media, and a lot of them aren't strictly true. What's important in the short term is you basically ask to their questions. They're obviously going to have certain contacts in mind, somebody who said they've come to your centre, and they'll want to be provided with information that they ask for, like who was with them, who was in at a similar time. And then they'll obviously go off and they'll investigate further. And it may well be that they advise that certain people, particularly your staff, may have to isolate depending on what was in place. What they may also do is get in touch with the COVID team, and they would ask us to be in touch with you in regards to what your risk assessment measures are in place. And you should possibly anticipate us getting in touch. But at the end of the day, the reason you have measures, the reason you have distancing, is so that if somebody does come in and they do have it, you don't have to shut down the entire premises. It would possibly only be the people who've had contact with them that would have to isolate, and your systems are in place to manage that contact so that you don't have to close the entire facility just because you've had one person in with a suspected case. So hopefully that answers the question. You know, it's basically they'll get in touch, provide information, and if your measures are good enough, it will only be the people they identify that would have to isolate.
Okay, thank you for that, Fraser. So as I say, moving through it then, so next question I'm seeing is actually one that the moderators put up, so that's one that we've received beforehand. Is there a set reopening date for reopening village halls? So I'm just wondering if that's, I'm looking at you probably again, Fraser, and others in terms of, is it, have we got guidance on that?
My opinion is that village, like the definition that we're using in this talk and what's in the legislation is community centre. Unfortunately, it's not a piece of legislation. Normally, if you look at legislation, there'll be a bit at the front that says interpretation. It'll give definitions for everything. Unfortunately, the regulations here are not one of those things. So I would deem village halls to be a community centre, and as such, from the 31st of July, they've been allowed to be reopened, subject, of course, to the appropriate measures and having a risk assessment in place.
Okay, thank you for that. So next one we've got is from Janet Newberry. So she's asking the question of, say, how can we open halls to people from 31st of August when only 8 people from 3 family groups are allowed to meet, thinking especially of exercise groups? So I suppose maybe get a wee bit of experience from maybe Connie and Duncan in this one in terms of, in a sense, I suppose you've got to think around activity and then maybe pass it on to other panel members in terms of actually thinking about the practicalities. So can I just draw you in first, Connie? Can I think about your experiences in terms of be here?
Yeah, hello, Reid. So basically, as far as I was kind of taking it yesterday with the First Minister's speech, that if they are allowing up to, I think she said, groups of 30 people, I will apologise because I do need to go over everything, as you can understand. It was a big day yesterday. But as far as I'm looking at it, it's a bit difficult because obviously you can go into a restaurant. So I'll give you a quick example. We reopened and did a couple of kids football classes because we were allowed to do contact for kids. However, I was only allowed 5 parents or adults on the AstroTurf, but they could go into the cafe and there could have been 20 different households. So I think it's got to be a bit of common sense, as you like, which is really, it's a bad thing to say just now because everything's so confusing. I'm not gonna lie, it's crazy, it's difficult to find things, but the way I took it was if she's allowing groups of up to 30 people in, then the number of households is obviously, I'm guessing is just going to be disappeared, the same as like your pubs and your hospitality sector. She didn't mention, and I did go on and read the update on UK Gov that I just spoke about previously, and it doesn't mention anything to do with household numbers. It just mentions that in a gym or for classes for exercising, adults have got to have an area of, it's 9 square meters, so it's basically 3 by 3 by 3, which again is a bit confusing because when you first read it, it's quite overwhelming for somebody like me that's not great with measurements. It is quite a big area, but I'm taking it, as long as you can follow that guidance, you can have as many as you can. Obviously the ventilation is a bit different, but you need to be able to ventilate your rooms as long as you can space everybody out more or within that, the 3 meters, 3 by 3 by 3, then I don't think there's a restriction. Maybe
Okay.
Duncan can help.
You want to add anything, Duncan, for maybe get Tim
Yeah,
in?
this is a classic example of where, as we've all been saying, you need to go back to the actual regulations, legislation, the actual stuff from the government, because yeah, some of it does seem very conflicting, and I agree completely. So hopefully we're not both wrong. I agree completely with what Connie's saying, and the regulation that's mentioned in the question, that there are exceptions to it, which is exactly what Connie's been saying. So yeah, once again, it's the case of not just taking what you hear in the press as necessarily being entirely accurate and going back and checking the legislation itself. So yeah, I think Connie's right as well. Hopefully we aren't both wrong.
Okay, thank you. Now just draw Tim now in.
I would agree with Duncan, and I think Connie's given some good examples. We certainly took an approach that, you know, in a way, the complexities of doing indoor aerobics to date with the family grouping was probably a good reason to not try it indoors. And we actually started to take the approach that Connie modelled with people having space outdoors. It was one of those activities that lent itself far better to, I think Duncan said, the car park. And I think, you know, that was a very practical way of dealing with it. One other option that, you know, that there have been some individuals who have specialised in dealing with that particular issue that have, you know, worked with families. And again, an alternative way is if they wish to do that, they can lease your facility or lease your ground and deliver it themselves, dealing with the complexities. But in fairness, I've come across very few people doing that.
Okay, thank you, Tim. And then I'll give you a heads up, Catherine. I'm going to draw you in this. So we've got quite a few with cleaning. So I'm going to try and see if I can link all 3 of them together, if that's possible. So we've got an anonymous one that says there's guidance. Is there any guidance in cleaning? Also the time between lets. And then Caitlin was asking, will third-party groups operating within the facility be responsible for cleaning to a reasonable degree before other groups, or where does responsibility lie? And then again, it was Tim mentioned this earlier, Sheena King was asking who's responsible for toilet cleaning if our hall has been used by non-committee members. So just wonder if you could just kind of try and take a whole kind of cleaning response there.
Yes, so there's various bits of guidance that you'll need to think about when you're sort of planning your cleaning. There's the it was mentioned previously, there's the toilet guidance. So again, that's talking about enhanced cleaning of your toilets. You need to do a risk assessment that's based on how heavily it's going to be used. We can't just create one cleaning schedule for that would suit everybody's facilities. They're used differently. You've got different demands on them. So again, it comes down to risk assessment for that. But definitely have a look at the toilet cleaning guidance. In terms of like sporting activities, I know that the Sports Scotland guidance that's been published, it talks about recommending something like a 20 minutes gap between lets. I believe that's right, sporting people. So there is guidance there that suggests the potential gaps between lets, and I think one of the questions related to who's responsible for the cleaning, and I think you should probably think about who would be responsible for cleaning. There's sort of two aspects. There's your normal cleaning that you would have been doing anyway between groups, and then the sort of the enhanced cleaning for the COVID purposes. So your enhanced cleaning of hand contact surfaces, the types of cleaning that you wouldn't have normally perhaps done on a regular basis. So that's something that I would suggest that when you're taking on a let, that's discussed and that's arranged between the two of you, because it should appear in your risk assessment what enhanced cleaning you should have for the hall itself, and also if somebody's hiring that space for a specific activity, what types of cleaning is appropriate for that activity. So the two should tie together, and you should be communicating with whoever's doing the cleaning in your hall, and also who's hiring the hall and what they're actually doing, what their responsibilities are. So it comes down to agreeing on responsibilities, as you would do with many other matters when you're hiring out your hall. I hope that answers the questions.
Perfect, thank you, Catherine.
Thank you.
So moving on, so slightly different topic here.
Sorry, can I just jump in there?
Yep.
I know this is going to be a big question for people with a gym, and it's certainly one of mine, Catherine. Before obviously gyms closed, users of, so I'm using, you're saying you agree obviously a contract with the let, so that's really easy for an external let coming into one room. Like obviously you can say, right, your responsibility is to clean it down after the use, so you need an extra 15 minutes. However, for example, for the gym, obviously a lot of people are doing like hourly slots, and we're now going to have to box out the spaces and things with the guidance. My question is, so if you're looking at it like that, technically one person, a member coming into the gym, would be classed as your let. Is it still acceptable to be telling them, obviously with the current guidance you would be stressing that they must do the wipe down the equipment after use, or does our staff then have to go in after every individual? Because the problem we've got here is, say for example, you've got 8 people in the gym. My way that I'm going to set up my gym is that once we've put the markings down, it'll be boxed areas, but there'll be 8 people that'll be in the gym at that time. So they won't be allowed in someone else's box during when someone else is already in it, if that makes sense, sorry. But I'm not going to have a member of staff that can stand in the gym and wipe down a piece of machinery once it's been used. So from my aspect, obviously, it's got to be a bit of customer responsibility as well. I'm asking if we're telling customers they must wipe the equipment down after use. It's up to them if they would like to wipe it down before they use it as well. And we will say that that would be good practice. Does that cover? Obviously, we'll have staff going up after the hourly sessions or the periods that we'll have to, but does that cover that 8 people in the gym?
That's a really good question. And
sorry.
Yeah, no, that's not something I have looked at the sport guidance, and I'm sure you have as well. And I don't think that's something that's been picked up on. I don't know if Fraser knows anything about that. Oh, we've got somebody else who might know.
So I was going to bring Tim in there. Thanks for that, Catherine.
Thanks.
It's not necessarily something I know, but I am a little bit of a, I'm going to make myself unpopular now, but I did a bit of a busman's holiday recently, and I was asking colleagues in England who have had occasion to sort of do this first. So bear in mind that what we're talking about is a slightly different legislative framework. It may or may not be relevant to Scotland, but the vast majority of gym operators in England are going down a route of timed slots and asking all individuals that go into those timed slots to undertake a range of measures, which can range from having their temperature taken in some cases, which might be a bit extreme, through to ensuring that they have sanitized prior to going in. So a group of 12 people might go into a gym for an hour, and the cleaning regime of the facility is then based around that hour. So in a lot of cases, you know, gym might be open for a 10 to 11 slot between 9:45 and 10. The in-house staff are cleansing it down. There's a number of people that are checked in, hand washed, sanitized for going in. They get an hour depending on the capacity of the gym. They are encouraged to wipe down equipment after they use it, but they know at the start of that session that it's been cleaned down before they do it. And I think that there were elements of them social distancing whilst they're in there. But I think a lot of the feedback we're getting from England is that if you're getting people going into a gym and heavily exercising, you know, it's a wee bit of a nonsense, the idea of cleaning down after each individual use. It's simply one of those things that's not as practical. So they've been very much majoring on what I call the blocking. So it's the pre-blocking. You pre-block your slot, you're sanitised, you're cleaned, your hygiene before you go in, then the in-house staff take in at the end of that session, and then the process starts again. So that's what's happening south of the border. Whether that fits in with Scottish legislation, I don't know the answer, but it's certainly something that we're looking at as to whether we can take that approach blended with, you know, Connie's, you know, what you outlined as boxing out gyms.
Okay, thank you, Tim. So I'm going to again try and combine two questions into one. It's actually from the same person. It's from Chris Rusbridge. So he's basically asking kind of two-part question here about it's around activity. So saying what would be the position regarding indoor dog training classes, and also is indoor bowling permitted? So just wondered, that's something for you, Fraser, to come in.
Take this. The indoor bowling one, that's a very simple one. I believe that from the 24th of August, the First Minister has said this is a definitive date that you can do indoor bowling. I don't know whether you refer to bowling or to bowls, but I would very much assume, from a risk assessment point of view, that the two different kinds of bowling will present the same level of risk. So that'll be from the 24th of August. You're allowed to do that, obviously subject to physical distancing checks. Dog classes, I can't say I've seen anything specifically mentioning them, but I don't believe there would be anything necessarily prohibiting them. There are obviously rules on physical distancing. They apply to humans, they don't apply to dogs. So long as you could manage the numbers that are attending the class in terms of humans, I don't necessarily see a problem with having an indoor dog training class. I don't see anything in the legislation, and I don't see anything in the guidance that would prevent that going ahead with the appropriate risk assessments in place.
Okay, thank you. As I was saying, I suspect this next one then is possibly for Catherine, and maybe even from Tim from a council facility perspective. So Carew, you're right, is asking is, would face masks in village halls also be mandatory for children? I wonder if you can come in, Catherine, from a kind of public health perspective. No?
I would like, I could quickly
that.
jump in on that, because I did look at this. The requirement for face masks in community halls is the same as the requirement as face masks in supermarkets and every other place, and as such the same exemptions apply. Young children would arguably be exempt, basically. If your child has been exempt up until now, they're exempt in a community centre. Obviously, we'd encourage as much children to wear them as possible, but it is a valid exemption in the guidance and in the law.
Okay, and anything from a council facility perspective, Tim?
Well, I can just put a bit of flavour in terms of our planning. We are taking, as we would do, because I work for the same organisation as Fraser, the practical approach we're taking is that when we're opening a community facility, when you're in transit in that facility, in other words, you might be entering, exit and going to your activity, the mask is necessary. If you then go into a room where your activity is taking place, and let's say, for example, it might be an exercise class, whatever, and that then is shut off to other users, you can take the mask off for the duration of that activity, in the same way that if you went into a restaurant, you would have your mask on until you actually sat down at the table, and then you take it off to eat. And then when you vacate that specific service area, your mask has to go back on again. And what we're also trying to do is if we can encourage, you know, if an activity doesn't preclude people from wearing a mask, in other words, if you can wear a mask and it's not going to be too inconvenient, we would always encourage that. But we're very conscious with some activities, the actual wearing of a mask, a bit like if you're having a meal, may on some occasions be impractical, but certainly the communal areas of activities, it will be masks on. I'm hoping Fraser agrees with that.
Yeah, okay, that's right. I'm going to draw Duncan, and Duncan's indicated he'll come in, so if you want to unmute Duncan.
Yeah, one of the things we have to be very careful about, certainly with our facility that's open to the public and has a lot of people with special needs coming in, both as customers and working in the place, please go and check the exemptions to mask wearing. They are extensive. and they do cover things like cognitive impairments, autism, that kind of thing too. May I also make a plea that it's very, very difficult to keep on the right side of Disability Discrimination Act if you start grilling people over why it is they're not allowed to wear a mask. So it'll take a bit of trawling, but somewhere on the Scottish Government website you will find the list of exemptions, and you might be surprised as to how many there are.
I could maybe add, it's on the phase 3 staying safe and protecting others guidance. So it's children under 5 years of age are exempt, as well as many others. So that's helpful.
Yeah, thank you, Catherine. Thank you, Duncan and Tim. So I say the next one, I think this is probably, I'll draw you in first, Tim, and as I say, possibly then protected services. I think this is relevant probably a number of our facilities. So David Dunkley is asking the question, a village hall has been used by the village primary school as a gym. So will this be able to continue? And obviously this is relevant that now schools don't always necessarily have the in-house facilities. They might actually have to use some of the community facilities. So I wonder if you can maybe open up that discussion, and then I'll draw in Catherine and Fraser.
Yeah, I see no reason why schools can't continue to use community facilities. The issue we're tending to have is that there's been some myths and rumours about if a school uses the facility, can anyone else use it? Certainly the council is now cross-fertilising school and community use in community facilities. Again, the way we're managing that is that we're treating them as individual users. So as long as the facility is cleaned and sanitised as appropriate before that group comes in, and cleaned and sanitised as they've gone, there's no reason either why the school can't continue to use it, or why users before and after can't continue to use that facility, subject to the typical crossovers.
Okay, no, that's fine. So we've probably got a bigger one here, and I suspect it's a difficult question. So somebody was asking now beforehand the question, will there be funding available for the loss of income since community hubs, gyms, exercise activities have had to close for 5 months? Also, will there be subsidised gym, class, soft play sessions offered the likes of 50% off on Monday and Tuesday and Wednesday for the hospitality sector? If not, why not, especially for the fitness industry? So I really can't, I'll maybe kick that one off then. So I can't really answer the question why not, because I think as many people are aware, there's been a number of interventions. So Westminster government have put in things like the now coronavirus job retention scheme, and that's getting funded through the Treasury. A number of other schemes Scottish Government put in place, such as the £10,000 that many of you applied to, and albeit Aberdeenshire Council managed that, it's important to remember that that was actually the criteria for that scheme was set by Scottish Government. We were really just instrumenters of it. What I will say is I think it's hard to add to this one specifically, so possibly if the person wants to come back in touch, we can explore it. But what I would say, and I know we've got Duncan here wearing another hat in terms of Banffshire Partnership, so I would say now get in touch with your local rural partnership, also get in touch with Aberdeenshire Voluntary Action, as well as being aware of kind of local funding. They're also quite well connected in terms of now knowing there's the Third Sector Resilience Fund will also be getting recast, and actually potentially that offers a potential lifeline, but there's almost too many funding options to list. But I would say first point of contact the local rural partnership or contact Aberdeenshire Voluntary Action, explore with them, and at the same time now the council is trying to keep its ear to the ground. If we think that there are opportunities and challenges that sectors are missing, then we are definitely working with our other 31 local authority partners through COSLA and trying to make the cases if they think there should be additional funding. So if that's fine, I'll maybe move on from that. So the next one is, I think maybe I'll bring Con in this one again, because this is quite specific about an actual activity. So it's, what is the exact amount of floor space required per person taking part in a yoga class, for example? So Connie, do you want to come into that one? Because I know you have that type of activity in your facility.
Yeah, so this was actually one read that I was actually seeking further guidance on, because the only guidance which I mentioned earlier is the 9 square meters, so 3 by 3 by 3. However, I'm kind of inclined to argue that if obviously it's yoga and it's not a high intensity class, I think you should be allowed more people in the area, but the way they've worded it is it's any classes. So to me, at this time, that would mean yoga as well. Me personally, I really hope I am wrong, but I think for all exercise classes, even your lower intensity classes at the moment, the guidance is it's the same floor space area. That's basically the only guidance that they've released at this time. I think it's probably because they kind of considered high intensity, low intensity. They've just gone with, they've got so much going on that they've stipulated the 3x3x3 box. So unless anybody else can clarify, I think the yoga would be the same. It would be the same floor space.
Okay, that's fine. I'm going to draw Fraser into that because he's indicated he could add a bit more from the Sport Scotland.
I did have a look at this, and if you're doing sports activities, I would strongly advise people to look at sportscotland.org.uk. They've got some very extensive guidance on the subject of sport. I believe they're probably rushing to catch up because a lot of this was 2 weeks ahead of when we thought, but what they do have there is very extensive. I would honestly believe the 3 meters would be the minimum. The guidance for that is a 3 meter by 3 meter by 3 meter box with with the option to increase that for more high intensity exercise. And it's not 3 meters either side of someone, it's a 3 meter box with them in the middle of it. So if you do the maths there, people will be standing 3 meters apart, which is only slightly more than current physical distancing. And this is possibly me going into opinion rather than the guidance. If you look at the guidance on face coverings, it does recommend where somebody can't wear a face mask for whatever reason, such as they're doing exercise, to maybe keep a bit more physical distancing. So that's possibly where I imagine this guidance to keep people 3 meters apart from each other during low intensity exercise has gone into the Sports Scotland guidance.
Okay, thank you for that, Fraser. Okay, and then moving on, as I say again, I think it's just somebody here in Anonymous looking for a bit of clarity around the whole phraseology and different classifications of people around social physical distancing. So what are the rules regarding social distancing for A, children up to 12, B, children 12 and plus, and C, adults? So I don't know if is that a protected services one that Fraser, you could jump into?
I could quickly take that. Basically, there's the NHS has some quite good guidance on this, and I believe there's possibility for it to change, but it hasn't yet, so I would always keep an eye on this. Children aged 0 to 11 don't need to maintain physical distancing, and they don't have any restriction on households. Children aged 12 to 17, so we're sort of getting out of the range of children and more we're talking about teenagers. They do still need to physically distance, and they do have they don't actually have a restriction on how many households that they can meet in a day. Once you get to 18 and up, I'm afraid while it may still be a moody teenager to you in the eyes of the law, they're an adult, and they have all the same rules for a number of households and physical distancing as adults hold.
Okay, thank you for that. And I'm going to like us back.
Yep. I'll just pop in there because there's probably, if people's looking in terms of football, Fraser, I'm not saying what you said is wrong, but the SFA, the guidance for the SFA, they actually changed it a while back that 12 to 17s could also play contact football. So what I would say to people is, you do need to go on to individual governing bodies to see, I know it's a lot more work, and me included would love just a case of the NHS, this is the rules, this is it, but obviously the SFA have got different rules. Obviously the numbers are limited, so it's like 10, it's 10 kids to 2 coaches in a certain area, but it's just in case people was listening to that and thinking, oh well, wait a minute, the football's been back. So it is under 18s. They did say that they can contact, but I'm just kind of saying that you do need to be looking at all the governing bodies for the groups that you work with to get the proper guidance.
Okay. And I would just like to quickly add to that, with the First Minister having announced a return to indoor sports from the 31st of August, because that's a confirmed date, I believe there will be guidance coming out in the very near future, which is going to expand further on what Connie's just said, because obviously if there's indoor sport, there is going to be increasing ability to, not be physical distancing in the context of sport, and the government's going to be producing guidance on this hopefully very soon.
Okay, thank you for that. I'm going to try and move as quickly on people before we run out of time. So, question here from Long May Hall. Does the provider or the user have to do the risk assessment for the activity hire, and which has to be provided in terms of the PPE and hand sanitizer? I suppose I think they're asking now, is it them as the provider of the whole that have to provide the risk assessment and the PPE, or should they be expecting the user to do that? So does anybody want to come in that one in terms of, I suppose you could do either or, but you need to think of this in terms of the practical responsibilities.
I'll have a go if you want.
Okay, thank you, Tim.
It's, I mean, and again, this is a personal view because it is a complex area. If you are facility responsible, in other words, you are running the hall, to my mind, and the way that we're approaching this is that you have to do your risk assessment first and foremost for the facility, and there is an absolute responsibility for each individual hirer that you can meet your obligations in terms of providing them with a safe facility. The provider is responsible for the service they deliver once they start on. And if I can refer back to Connie's point of view, Connie was absolutely right. The provider is then responsible if they're delivering, let's take football as an example, they have to both deliver it in line with your risk assessments, and they have to look at their governing body or appropriate advisory body for what specific rules relate to themselves. So in simple terms, as a facility responsible person, you're responsible for the risk assessment for the building and ensuring people's safety. The user is responsible for the service and, if you like, their service to their clients. There is, to me, a grey area, and my colleagues may disagree, as to what's the policing responsibility for the service. Do you as a facility provider need to actually police the risk assessment of the service provider? I don't have any easy answers, but the way we're dealing with it is we have meetings, or we liaise with our users. We look at their risk assessments. We've occasionally had the funny situation where a user's come in and said, here's our risk assessment. It says we have to have exclusive use of your facility. You'll be kicking everyone else out so that we can use it. That's the point we say, we're ever so sorry. That doesn't fit in with our risk assessment. That's not possible. You'll have to amend your risk assessment. But essentially, it's a conversation about how their risk assessment links with your own, so that you can ensure they can provide their safe service and you're meeting your responsibility. So hopefully that's a practical answer.
Okay, thank you for that, Tim. Okay, so moving on, so a bit of a longer question here, and I suppose it's really around, obviously, groups being quite confused in terms of what the allowable activity is. So this is Bill saying there seem to be specific activities that are named as allowable to restart. For example, exercise, some sports, dance, etc., but no specific permission on the lots of other activities like drama groups, choirs, reading group. Are all these other activities that are allowed to start, provided the risk assessment and COVID safety measures can be implemented? And how would these guard in conflict with the guidance of maximum numbers and the maximum number of households? So now, can MD comment in terms of that, in terms of now the definitions of activity, that gives the holes a bit of guidance here? No. Okay.
Yeah. Well,
okay. Thank you, Catherine.
What I would say is you have to refer to the phased approach that the Scottish Government are taking, and have a look at that, and where those activities are placed on the phases and what starting dates there are. If you're really struggling to figure out a certain activity and where that fits into the phases, you can always get in touch with us and we can see what we can do to help you with that guidance. Does that, hope that helps? Yeah,
that's fine. As I say, and we will go through all these questions, as saying, if we think we can find more up-to-date guidance or more detailed answers, along with some of our other colleagues who've not been able to join us, we'll add extra information. So somebody's asking the question, is there now risk assessment templates that can be shared and used by village halls?
I could answer this. I don't believe there is. There's a couple of ones floating around online that are very much aimed at the English legal requirements, and while they're quite good for that, it is still the English requirements. What I would highly recommend is go on the HSE website. Understandably, the HSE have got an entire section on coronavirus, and one of the things they do have is a sort of semi half-written risk assessment that goes through it step by step. highlighting key areas, saying what you should consider. It's a very good document, and I would look at it because, you know, risk assessment is the HSE's bread and butter. I would say their guide would be the go-to as a starting point. And if you do have any more questions, one of the things that the COVID team have been doing is people have been passing their risk assessments to us for a second opinion, because there's always something that a second pair of eyes is going to raise that your own hasn't.
Yeah.
Okay, thank you for that.
Also, if I could add to that as well, the Food Standards Scotland website has a coronavirus risk assessment template for you to follow. So if you're providing food, it's certainly something that you should be looking at.
Okay, thank you. And now one here from Janet W saying our whole committee AGM is due to be held in a couple of weeks. Will we be okay to hold this in the hall, provided chairs are suitably spaced out? So don't know, Duncan, if you've got any experience of that, if groups coming to you for advice. I definitely can give a wee bit of an update in terms of updated guidance that Oscar, the Office of Scottish Charity Regulator, has given. So I'll draw you in first.
Well, I don't know if I know any regulations on it, but what I do know is that the Scottish Government has provided, well, I think it's very sensible advice about business meetings. Might not be just quite the same thing, but what they're saying is don't hold them as a physical meeting unless there's absolutely no alternative. And is there something vital that they would achieve by being held? So I think, you know, lots and lots of organisations have got written into their constitutional rules that you must hold an AGM on a specific date. But I would take the view of, do you really actually need to do that? And is it actually going to achieve something?
No, that's fine. I'm going to draw Connie in and then I'll give a wee bit of an update from my perspective as well. So when you come, Connie.
Yeah, no, I mean, obviously what Duncan's saying is the safest option, but one of the things that I've got in my mind for my staff coming back is obviously it's great to say, okay, we'll do everything over the video, but what I think people need to take into consideration now is there's a lot of anxiety out there. People, I think, need to be going back into not regular meetings, but maybe like your one-off meetings. So we are actually having a meeting with our staff next week because, I mean, I'm not going to lie, when we first reopened the cafe, I was ill. I didn't know if it was happening. It was really distressing. And the one thing I don't want is my staff coming back with that feeling, not having been in for their first meeting back. But the other way of looking at it is, although there's maybe no guidance on it, my common sense thing to kick in would be, if they are saying the 3x3x3 box for physical activity, I know that's the minimum, surely that would be enough to cover you safely for sitting inside for a meeting, if that helps in any way. That's how I would kind of look at it. I think it's more just, I would like more face-to-face and getting back to being in the facility for my staff. And so it is more a staffing point of view, but also your customers as well. So an AGM, I do think that's quite an important thing, depending on the numbers, if you know how many people are coming. Again, if it's too many people, then yes, definitely not. It would be probably better on live, if that helps any, sorry.
Okay. So I'll just add to that. So just think you're absolutely right, Connie, in terms of drawing the staff in. I definitely would take the view, and that definitely is a guidance from Oscar, that AGMs are not essential. So if you're following the government's guidance, then those would not be considered an essential meeting, and therefore what you should do is look at doing online, and there's definitely, again, help and support and resources that can help groups do that. Oscar, equally, for those that are charity, have said they will not be punitive to any organisation that has clearly had to delay. In fact, I think the initial guidance was they said they were more than happy to delay the AGMs of anybody who was due in March for another 6 months, where you've saw the same with people's MOT. So I think, again, most regulatory bodies are being quite considerate, but definitely I think the clear advice would be that in most cases you really should be thinking about trying to hold it online using maybe, I mean, this platform might not be for everybody, but you definitely have participated in Zoom board meetings and Zoom AGMs myself with other volunteer groups. Now there's WebEx, there's Teams, so there's lots of free offers and opportunities there. So moving on, so we've got Apologies for my pronunciation of your name. I think it's Emir Bell from NEAT saying any updates on live events in village community halls, theatre performance. So this, I suppose, is somebody who's the hirer or user of village halls, just looking for a bit of update now. Where would their activity? Is there any update? So Fraser, Catherine, have you picked up anything in the kind of emerging guidance?
If you look at the Scottish Government website, they've got their update on phase 3. And it's very much stressed this is an indicative date. Certain indoor live events subject to guidance with physical distancing, etc., potentially from the 14th of September. Unfortunately, this hasn't been confirmed. Obviously, it's an indicative date. It's not a confirmed one, and it doesn't say what indoor events will be allowed because it is still the case that some of them will not be. So I'm afraid that I can't really advise on when or what format you're going to have to do it in, because at the moment it's indicated it may be from the 14th of September. That's not confirmed. There may be guidance. I'm afraid it's something I can't really give a definitive, comforting answer to you about.
Okay, no, and this one maybe again we'll see if we can answer this one, but it's quite a specific question. So Pamela's asking the question: we lease a church building on a Sunday to another church which is independent. It does not have a management body such as like Church of Scotland. How do we stand there? And one of our rooms is used for toddler groups. Previously had 60 attendees, has no windows, just a door in the hall and one to the outside. So can we still use that room? And this is going to be our last question, folks, so I need to close the webinar down shortly because we're running out of time. So can anybody pick that question up?
I can make one comment and people may wish to add in. It all depends on your risk assessment. If you've looked at your risk assessment and you feel with the knowledge of the building it can be done safely, then it can be done. But I don't think anyone can give a definitive answer until they've got the risk assessment in front of them.
Okay, no, thank you for that, Tim. Now, as I say, I appreciate people, as I say, now we've got something that way over 100 questions. I think we're always going to find that a challenge, but as I said at the beginning of the webinar, we will pull those all in and try to get those answered. But as I say, we now need to come to a close. So can I thank Duncan, Fraser, Tim for doing their presentations. I think that was really helpful and stimulated the discussion. And then for Catherine and Connie, who then came into the panel. I absolutely have to thank my colleagues and especially David behind the scenes who in a sense have made sure this webinar happened. As I say, some of you only vaguely know how much efforts now we had to do to make that happen. We'll make the recording available as soon as possible. I also would ask for your perseverance here. We'll circulate our SurveyMonkey link as well. So we'd like your feedback on what you thought of this webinar, and please by all means comment if you think there's any future topics that you would like to see us cover. And all it really remains for me to say is really, I wish you every success in opening up your facility and hopefully enjoy the rest of the day and weekend. And many thanks for participating. So take care and have a good day.